All right, so if we can draw everyone's attention to the stage now. We're just going to be returning to the panel. And again, reminder, you can ask questions on cue cards that will be going around. You can use hashtag CannabisYYC, or you can email cannabisyyc@gmail.com. And I'm going to pass this over to Eric now.
Thanks very much, Aleem, and thanks everyone for being here and for inviting this panel and me to help moderate it. Dr. Barawani spoke earlier about the contribution of pieces of the puzzle. It's so important that the organizers of this event have strongly advantaged the voice and the contributions of citizen patients. We're privileged to be able to hear from three people in this session, Sarah, Holly, and Ryan, who you'll meet in a few minutes. Dr. Hill talked to us about what counts as evidence and talked in sort of my world in medicine and in science. I was really thrilled to hear how much evidence and research has been going on in a group of 12 labs throughout the world and probably others over many, many years. But at the end, he said, we really don't know very much yet. In the science world, we talk about evidence in randomized controlled studies and other things like that. But we recognize increasingly that there are many other different kinds of evidence. And one of the real important bits is the experience of people who are in the system, who are subject to whatever policies, laws, regulation, and access are. The narratives count as evidence, and the stories that people tell are very important bits, especially as we're thinking about social policy. So we're very privileged to have some of that evidence being here today and focusing on the ability to listen. In social policy and in ethics, we talk lots about both the process and the substance of the issues. So we want to be able to say in process considerations who ought to be involved in deliberations about really important and difficult subjects that we need to determine going forward as a society and as a population. What kind of appeal mechanisms should we invoke in our society for people who may be subject to a particular regulation or policy, but may think that it doesn't apply to them particularly, or that they need to ask the question again, well, why or why not? Again, we ask, what about the public wisdom? Not just the scientific evidence, but the public wisdom and how that counts as evidence. And in the substantive area of social policy and policy development, regulation, and law, we also talk about other things. So in public health ethics, we would talk about things like respect, fairness, the importance of reducing inequities as a prime thing that we do, and our duty to protect other people. Dr. Gelly talked earlier about our need to advance knowledge, to convene discussions, and then advance policy around those things. So these are the substantive and process mechanisms by which we actually come together as a society and make good decisions for people. So we want to respect persons and communities, and sometimes those are confluent concepts and sometimes they aren't. We want to make sure that we've attended to justice and fairness. Are the goods of society available to all people in an equitable way? Not always equal, but in a fair way, in the way that we distribute resources, in the way that certain people are subject to particular kinds of laws or constraints. We want to talk about responsiveness. When we see an issue, a new issue, how do we respond to people who may be facing a clinical crisis at the moment, but also how do we respond as a society to the need to make new laws? And that brings up an important issue for today. Interestingly, in many social policy areas or in science development areas, there is the scientific community or social policy leaders who actually lead the work, and the population is subject to it. It feels very different for this issue, where the public may be far ahead of what science has known and far ahead of what social policy has already determined. So we ask the question, who ought to lead and who ought to be involved? To what degree is there trust in our social institutions, in our healthcare system? And we'll hear lots about that today because we've asked these citizen panelists and public members who are patients to talk about the kinds of things that they've faced in the system, the stigma that they may have faced, what that means for them as they approach a healthcare system or individual providers on their own behalf, or for their family members and expect to be treated with decency and trustfulness? What about our need to be accountable for very good decisions as a health system and as a society? What about our responsibility for making those good decisions, and how well do we include all the people that need to be included and transparently talk about the issues? So I'm going to stop there and ask that our three panelists, so in turn will come up and each spend about 10 minutes telling about themselves and their story and how that their particular story impacts on some of these important issues, especially around access to what they needed from the health system, and also to tell us a little bit about what they might dream about a future looking like.
First, I'd like to welcome and thank you all for coming out here to learn a little bit more about cannabis legalization, to listen to our stories, keep an open mind. When I was first asked to speak, I thought, no problem. I've done a lot of media. My daughter Maya is an 11-year-old cannabis patient. I didn't really think much of it. I thought, yeah, sure, I'll get up and speak in front of 400 people, no problem. We've done the national. But then I realized who was going to be in the audience, and in my understanding, there's quite a lot of AHS workers here. I see a lot of physicians that I've had contact with previously. I know Calgary Police Services is here, and I think that's wonderful that we're all kind of coming together to learn about these things. Oh, and the one and only Kyle Wilson. I was bribed to say that. So first I want to tell you a little bit about how I got here, because if you were to tell me 10 years ago that I'd be standing up speaking about cannabis use in children and how it has positively affected my life, I would have thought you were all using harder drugs than cannabis. Maya's pregnancy, my daughter's pregnancy, went great. Shortly after birth, 29 minutes to be exact, she had her first seizure. From then, it didn't stop. She was diagnosed with early infantile epileptic encephalopathy of unknown etiology. So some of you will know that that means she has a lot of seizures and we have no idea why. So her prognosis was death, likely within the first 2 years. We were very fortunate that she made it past that 2-year mark. I think once we got around 2 years, I thought, what do we do now? She was still seizing daily, hundreds of times a day. We had her on cocktails of drugs. We prepared as much as we could for the inevitable. Her first drug, given, I'd say she was a few hours old, was phenobarbital, which is a barbiturate. That didn't stop the seizures, but it did make her lose her ability to eat. So she was no longer able to suck. She lost that ability. Dilantin caused acute liver failure. Codeine, she was actually overdosed accidentally at ACH, at Alberta Children's Hospital, a hospital which, to my knowledge, has a no codeine policy. Sabril, Keppta, the ketogenic diet, IVIG, clobazam, diazepam, Ativan, nothing worked to control the seizures. She also had a history of status epilepticus, which means seizure for, generally they say it's over 20 minutes, but Maya's shortest status was 2.5 hours. Her longest was over 23. And then that's when the big hitting drugs would come out. So she would get a pheno and midaz infusion, or ketamine and propofol. And she was, we started doing this when she was a year old. Ketamine, we're in Alberta, so I know maybe there's a few farmers here, I don't know, but that is also used as a horse tranquilizer. And they had no issue giving it to my 1-year-old daughter to stop her seizures. We didn't have a choice, though. Then came the day that we had been dreading. She was 7 years old. She had come out of a 23-hour status seizure. She was in a medically induced coma for about a week, was having a very difficult time waking up, very traumatic extubation. And her physician sat us down and said there's nothing left for them to do. There were no other drugs to try. There were no other therapies. That was it. We had reached the end of our road. So we went home and told our boys. I have 2 teenage boys as well. And that was probably the hardest thing I had ever had to do. First, listening to her doctor telling us that her death was imminent, but the worst part of all that was sitting my boys down and telling them that their sister didn't have much left. That night, though, I couldn't sleep, obviously. So I'm up on the computer, as most special needs parents are, until 3 a.m. And there were murmurings of cannabis as medicine in pediatric epilepsies, namely Dravet syndrome, as Dr. Hill had stated. Maya was originally diagnosed with Ohtahara, which is closely related to Dravet syndrome. The only difference is basically is that the suppression burst pattern is constant, whereas in Dravet, I believe it's only during sleep or awake periods. So I knew that this was an option, but I also knew that it'd be very difficult in Alberta to find a signing physician for a pediatric case 4 years ago. So what did I do? I tried it on my own. I knew medical growers in BC. They had a 1-to-1 ratio of CBD to THC, which was, because at the time everybody was talking about CBD for pediatric epilepsy. And the highest in Canada at that point that we could get was about a 1-to-1. So I did that. I learned myself how to make the oil. I took a lot of the research actually from Israel in dosing, and that's how I learned to dose her. The effects were immediate. She stopped seizing immediately. So after about 2 weeks, I decided to fess up to her doctors, cross my fingers, and hope I wasn't arrested. And he said, she hasn't seized at all, and I said, not at all. And he said, the papers will be signed in your email within the half an hour. And they were there in 5 minutes, and at that time, it was the MMAR program. So we were able to get that. But in order to get to that point, I actually had to separate from my husband because when we were trying it on our own, I was so afraid of Child Protective Services or the police that if we separated, he could feign ignorance. I would take the blame for it because he's a primary breadwinner, and I would take the fall for it and go to jail. And I'm not saying to do this. I'm not suggesting that anyone go out and do this. I'm letting you all know because it's absolutely ridiculous that I needed to do that to separate from my husband of, at the time, 14 years, just to give my daughter a quality of life and to stop her seizures. But then there was no, this wasn't a happily ever after, so you can save your claps, because after a year, a successful wean of all pharmaceutical medications, seizure-free, and a normal EEG, despite a slow background rhythm, which would be consistent with somebody who has any type of learning disability, her EEG was completely normal. And despite all of that, her doctor couldn't re-sign her. There was a new policy at Alberta Children's Hospital, and he was unable to sign. I felt that my best bet, because now at this point we're left again, she's an unauthorized pediatric cannabis patient. That doesn't put me in a very good position. So I felt that my best bet to protect her would be to go to the media because public support is crucial. This is, let's be honest here, if this was a health issue, this would have been studied and implemented into our healthcare system 60 years ago. This is more of a political and social issue than a medical one at this point. So we had to actually fly out to Ontario. We found a compassionate doctor in Ontario who signed and also apologized on behalf of his colleagues because the evidence was so overwhelming with the normal EEG, seizure-free, no medication, and only using cannabis oil. But even through that, we faced an enormous amount of judgment in and out of the medical community. But I didn't care because it worked, so they could judge away. Her physician had been the one to originally ask me to go to the media because he said, in his words, his hands were tied and then backed out at the last minute and wouldn't stand up for what he called a miracle. So a man of science believed there was more evidence for miracles than there was for cannabis oil working to control seizures, which kind of blows my mind. But so we talked to everybody who would listen, and all of the so once we went to the media and I explained our story and I told Maya does use the THC and she does use CBD because CBD does alone causes more myoclonus, so maybe the Dr. Hill can explain that because I have no idea why. But the 1-to-1 ratio seems to work very well for her. But people of all backgrounds judged. And, I thought just take one walk in my shoes. What would you do if you had something that could save your child, but the law prevents you from giving it to them? To me, it was really a no-brainer. The out-of-pocket expense alone to buy the cannabis monthly, because this is not covered by any insurance companies. I would rather put that $1,000 in my pockets than spend it on a medication that wasn't working. It's clearly working for her. And now we're on the horizon of legalization. Some are happy, some are angry, some are apprehensive, and I think all of us are a little anxious to see what's going to happen because the world is watching. The legislation is strict. In my opinion, I think it's a little too strict. I would be given more time in prison for giving a 17-year-old some non-psychoactive CBD than if I were to sexually assault that same 17-year-old. And as a cannabis patient myself, who uses it for PTSD from sexual abuse stemming from childhood, I can absolutely tell you that sexual assault is worse than cannabis use. We all want the clinical data. I want it. I was asked 4 years ago for Maya to be a part of a study out of Toronto Children's Hospital, sick kids. They are just beginning now. 4 years of bureaucratic bullshit and red tape to finally get a study going on a large scale. I want a large scale clinical trial because I know that this works. I see it every day. I see it in my daughter's eyes. And so we need this research, and that's why I'm pleased to announce that I've been nominated to the Cannabis Research Fund, volunteer board as a founding director. My motivation to help Maya and other kids, my heart lies with the kids, obviously. Like her, I believe will be an asset to the CRF's mission to support university peer-reviewed study and research, industry-funded. And through all of this, through all of the stigma, the judgment from the medical community, from socially, I decided to take that and create something out of that. I thought, you know what, there are so many, I've spoken to hundreds of special needs parents who are either using cannabis oil as a treatment for their children or wanting to use it. And we all face the same thing, and that's stigma. So I said, you know what, we can do better. We can do better for medical patients. And so that's where the idea of Maya's Temple grew. And we are now partnered with a national company, NAC. We have a network of doctors available to us, cannabis-friendly doctors, that we can set patients up, no fee. Obviously, we're an education center and also like a health center. We do yoga and things like that in the back and meditation. So as everybody comes up to tell their story, everybody's story is going to be different. Today I was asked to speak about Maya. I've got my own story. These people up here have their own stories, and I see a lot of familiar faces in the audience that have their own stories. I implore you to listen, to keep an open mind, to put aside the indoctrination that we all grew up with, that just say no, drugs are bad. And they are, but cannabis is an effective medicine. And it has completely changed my life. It has brought my family back together. And although I may not have my daughter forever, the fact that I've been able to give her, or that cannabis has been able to give her 3.5 years of seizure-free time with me, the fact that she can now say, Mama, that's really all the evidence that I need, personally. But let's get these clinical trials going. Let's get this research going. We want it too. Cannabis patients want it too. We're not saying no to science. We're saying yes, science, please. So let's cut through the crap and get these clinical trials going because we need this evidence. There are children dying every day because of the lack of evidence. So please keep an open mind while you're listening to these stories. And if you have any questions, I guess, write them down and we'll discuss them at the end. And that's That's all I have to say.
Thanks very much, Sarah. So a compelling personal story of a mother and a person, a patient, who also has now developed a call to action that we heard really clearly, and we'll hopefully have a chance to chat a bit about that later. And thanks for being out in the public so much and letting people know about your story. It's a hard thing to do, but it's also a really enlightening thing to do, and it's helpful. Holly is going to tell us her story, and this is the first time that she has publicly told this story. So with great sensitivity and appreciation, thanks for being here.
Hello. So I'm super nervous. I don't know if you could tell, but I'm very nervous to share this. So, and the funny thing is about this speech is that last night my neighbor, he's an addictions counselor, was the one who was helping me with this. So it's quite ironic. So my name is Holly Rachynski. I'm 33 years old. I'm a mom. I'm a wife. I'm a daughter. I'm an aunt. I am a kids yoga teacher. I work for Alberta Health Services full-time, and I am a cannabis user as well. And so my other side, I am a sick person, and I am a survivor. So I'll share those stories with you. I'm from the Kootenays, so I'm from Calgary, BC. If anyone's familiar with the Kootenays, there's more marijuana going around than pretty much the MMR vaccine. So that's Nelson for you. And so yes, I did try it occasionally as a teenager growing up. And I'm pretty sure whatever I used was an herb from someone's spice cupboard, but it was marijuana to me. And then I moved to Calgary, and I still was using it occasionally. And I ended up, I went to a Def Leppard concert, and I may have consumed more than I thought I could, and couldn't hear the music or feel my legs. So after that, I was done with marijuana, and it scared me, and I was nervous to use it, and I had my own stigma created about it. And the funny thing is that my husband, he's used it since the day I've met him. And so after I stopped using it, I was super hard on him. I was angry with him for using it, and I didn't want him to be around the kids when he used it, or smell like it, or have any of the stuff around our house. And so I really had my own stigma about it for sure. And so I wish my husband was here. I would apologize to him. I'm sorry, Tim. But I want to go back a few years. So I was 19 years old, and I'm the small town girl living in Calgary, and I am experiencing this big city life. And so I would go out with friends to clubs and, consume some beverages and meet new people. And one day when I was at a club, I was going to the bathroom, and I was pushed into the stall and raped in the bathroom. And then he left, and that was that. And so I went and told a friend what happened, and it was her friend that did it. And she told me that I was lying, and it didn't happen, and I was the cause of it. Sorry. And so after that, it's amazing what you can really put down deep inside of yourself when you just want it to go away, or you don't realize it was as bad as it really was, right? And now fast forward to a year ago, I was triggered. I saw this girl at a restaurant. She was serving me, actually. And after seeing her for the first time since then, I was just triggered like it happened the day before, and all of these memories just went into my head. And the looks of people's faces when I came out of the bathroom stall, and just everything came flying back at me. And I didn't really know how to deal with it. And so I went into depression. I had major anxiety. I had trust issues. I had to take time off work because I was just a mess. And And then from that stress, I don't know, I know there's lots of physicians in here. I don't know what your say is on this, but I really do feel like the stress that I felt at that time was a huge contributor to the fibromyalgia that I was just diagnosed with in January. And so, and now with the fibromyalgia pain mixed in with the PTSD, it was pretty awful. So feeling all this pain in my body, I didn't know what to do with it. And of course, fibromyalgia and a sex assault victim are two huge stigmatized things in this world, really. It's not a real illness, or that's just how I felt. So, and then after finally being diagnosed with fibromyalgia, I was put on Cymbalta and Lyrica, and I don't know if you've ever seen the commercials for those, but the Cymbalta, it's pretty much like side effects are you will die or have anal leakage, or like it's awful stuff. Liver failure, like why are we being put on this stuff if that's the side effect? And for marijuana, I can just imagine, will cause munchies, dry mouth, and possibly a long nap. Like, right? Like what else? And to me, it just makes sense. Like why would this be the first thing that we put patients on, are these medications that we don't even know work? It's really, we don't know if it works. And so the Cymbalta didn't work, and so the Lyrica is what I was put on after. And it's also not working. And so then comes along the marijuana. So my husband talked me into trying it one day because I was just in so much pain. And for the first time in a year, I felt no pain in my body instantly. It was instantly. I felt anxiety lift away from me. I felt happy. I felt like myself. I didn't feel like the sick person anymore. I felt like Holly. And instantly, I have to say, with my path to find it, I never had issues getting my prescription, so I was very lucky to be able to find natural health services right away and get my prescription. But the worst part is, of course, with my physician. So I'm obviously a frequent flyer in the clinic. So the day I told him I was using it, he just kind of went, okay, and then he moved on. Like it wasn't anything. We didn't talk about it anymore. He didn't make note of it. It was just something I told him. He instantly moved past it because it made him uncomfortable. So, and to me, that felt like there was no support. I kind of lost trust in my whole care. There's no connection. And so to me, I feel like that would be one of the biggest things in the future, is for that family doctor to be able to connect with that patient and to be able to accept that that medication is actually medication. Yeah, and so, sorry. Where am I? And so I want to kind of read the definition of stigma. And I want you to sit with it for a minute. So the definition is a mark of disgrace associated with a particular circumstance, quality, or person. So when I hear that, it makes me really sad, because there's a disgrace upon me, because I'm feeling better, because I'm not sick when I use it, because I'm the dirty pothead. Like it's just, it's not fair for that. I really hate that word, the stigma word. So anyways, I can say that the marijuana has definitely improved, and I have found support. Any of the Calgary Cannabis, I think it's you guys, Calgary Cannabis Club? Are you guys, whoever's here, claps, stand up, I don't know. There's been huge support through them. On Facebook, they have a page, and any questions that someone has, they know. I swear to God, they know better than a physician would. So anyways, thank you to those people that are here. And thank you for listening to my story. I'm done now. So.
Thanks very much, Holly, for your courage in telling that story, and especially with your colleagues in the room, but to all. So again, a very powerful story about the challenges that people face in their journey towards a desire for health. And in both of Holly and Sarah's stories, we've heard about the challenges in the system, not because the system is full of bad people, but because the system is constrained in some really important ways by legislation and regulation and scientific knowledge and policy and culture. We're going to now move to Ryan, who has been a strong advocate and a public spokesperson, who will also show a little bit of a video and describe a little bit of his journey through his use of cannabis, his medical story, as well as how he works with the system to try to inform people well. Ryan, thanks.
Thank you. That video is just one of hundreds of stories I have within my medical journey, and with its main focus on quality and safety, as you can see in healthcare. But it features the stigma of medical use of marijuana and how it almost cost me my life. What did they miss? Well, in addition to talking to me, they were given my in case of emergency sheet, which highlighted the severe ankylosing spondylitis, which is inflammatory spinal arthritis, with my spine fused except for some in the neck. Severe osteoporosis, subject to fractures, severe Crohn's. Then they went through all my medications, and what I didn't know until I got to the hospital is I had a 2x4 rug burn on my forehead where the contact point was with the floor. Based on the pain medication I was taking at the time, there was absolutely no way I could experience a 9 or 10 pain unless there was something seriously wrong. The paramedics in this instance arrived before the firefighters. The annoyed medic that didn't like the marijuana sent them away even before the assessment was complete because there was nothing seriously wrong. After the assessment, they didn't even think they should take me to the hospital, and I said, I absolutely have to go. There's way too much pain. And so they're like, well, can you get up and walk out? I said, I just came to when you walked in the room. I tried to get up, I can't move. So he said, if we help you get up and hold you as you walk down the hall, will you try? So I said, sure. Once in the ambulance, I had to demand a towel or a pillow or a collar as we turned a corner because the pain just became unbearable. And like I said, they take me to the wrong hospital. They realized in the assessment, of course, I can't just get up. They couldn't take me out on the stretcher. And when I got to the first hospital, they told me I had a broken neck, but it wasn't until I got to the foothills and they showed me the x-ray that I realized I'd anatomically cut off my head. It's called the C2, fracture through the base of the dens. It's the hangman's fracture. It's the bone they try to break when they kill you. So 99.9% of the time it's fatal, paralyzed, and so this is a true miracle. I'm walking, talking still. The main pain I'd fought for the decade was in the neck. It had been full tension. Currently, I'll just quickly say 13 diagnosed conditions, 15 medications. It's very difficult. But anyway, I get back from the hospital, and the same thing happened with the marijuana. I'd smoked early in my life to treat the pain. I ripped off a finger at 9. I was diagnosed with my arthritis at 13, and I just ignored it and kept dealing with it until I actually had to. But I get back from the hospital, 2 to 3 nights, I have trouble sleeping in the halo, so I thought I'll smoke and go to sleep because I use it for that. I took 1 puff, 2 puffs, and my body didn't want it, and I couldn't smoke it. It was just like the pain went away, what we were fighting with the opioids and the marijuana, your body doesn't want it. And as I carried on with my pain coming back, I got back to using it again. But there's little doubt anymore about how cannabis can be used to improve many people's medical lives and conditions. Prior to the 90s, as discussed earlier, all research done was to try and prove what harm the drug caused you, and that's all, nothing about the good side. Since then, and I know in Canada we have a thing called CCIC, it's the Canadian Consortium of Investigation of Cannabinoids. It's headed by, I believe, Mark Ware, a pain specialist out of Quebec, and they have a lot of research papers done on how good it is for you medically now, and I suggest some people have a look at that. One of my grandfathers, he had the same spinal condition that I had, deforming and pain. Unfortunately, he treated his with alcohol and suicide at 45. I know for me personally, I've used it to battle the pain since my 20s. I absolutely wanted nothing to do with getting involved with an opiate drug. But my doctor, I'm a very, 35, I was running a very CEO, president of a big business. I had my activities, I have 2 kids, I was coaching hockey, just had a very extremely active lifestyle, and my doctor said you could basically, you cannot take the drugs and live for 20 years with no quality of life, or you can take the drugs and have 10 years of good quality of life. And I chose the 10 and be with my kids. It was about 11 years after I started that I had the fainting from the low blood pressure, broke my neck, so I was actually scheduled to die about then, go down on the drugs. So I say I'm on 2nd round now. And I'm glad I'm here. I guess I got to see a few things in the last few years, that have been great. But living with severe constant pain, 20, 30 years, I gotta tell you, it's very hard to fight and keep going. Opioids block pain, whereas cannabis has a more deferring effect of the pain where you don't think about it all the time. I don't believe marijuana is addictive in any way, unlike opiates. And opiates are not addictive if they're taken properly. The key is you have to live in a bit of pain, whether it's 2 weeks of surgery or chronic pain. Is it realistic if you've had major surgery or chronic pain to not have any pain? No. As long as you live in a little bit of pain, your body will not become addicted. I'm proof of it after 11 years of use and being at such a high dose, going down in the 2 days. In 210, I was switching medications, and I asked my doctor, I said, okay, you now give me enough medication that if I gave it to somebody else, they'd die. So what would happen if I woke up tomorrow with no pain on my neck? And he said, if you behaved yourself and you live in a little bit of pain, you'll be able to go off it in days. Otherwise, it'll be like a 6-week nightmare, probably with all the sickness. Similar to opioids, cannabis doesn't get you high in the same manner as when you're using it recreational, if you're using it medicinal. One of my big beefs is people are always comparing alcohol to marijuana, but they are really too different to compare. Alcohol is extremely impairing compared to the marijuana. You experience significant changes to your cognitivity. You can't walk, you can't talk, you can't drive, or think properly. People think they become Superman and can do anything. Worst of all, it often leads to violence. Whether it's fights in bars, streets, domestic violence at home, it wrecks marriages, employment. Using marijuana really relaxes people, calms them down, and they can complete a task at hand or do anything they want. It doesn't have the same type of effect on you. While pending legislation, recreational medical users and legislators need to figure out the driving issue. My experience is that high drivers pay very close attention to driving perfect. Why? They're paranoid. Happens. They think everybody in the road knows they're high, and they don't want to get pulled over, so they drive perfect. Have you ever seen, none of the cognitive thing, have you ever seen someone really drunk read a book? No. But I can guarantee you have high school students and university students that smoke it so they can study better. So that's a little bit of a weird one. Anyway, laziness, well, if it was me, no. Like I said, I was active in sports. I played every sport till I absolutely couldn't move anymore. I was a president CEO of a very successful business, 29 employees. We were one of the fastest growing companies in Canada, and I raised my kids, coached hockey. It was amazing. It never made me lazy. I still hunt, fish, and shoot as my main 3 hobbies, and I will never give them up for anything. But to give you an idea, a day like today or just one day of my hobbies puts me in bed for 2 days of severe pain, maybe no sleep, no matter what I take. Anyway, we wanted to also discuss stigmas of marijuana, and so I am just going to end my story now, and we'll answer any questions you have regarding my story or talk about stigmas. Thank you very much.
So we have a few minutes left, and we're going to see if there are some questions from the audience on the cue cards as well. But just to start, before they come up, I'm going to ask you all three this question, and thanks again for your honesty. I have to say, in my world in palliative care, we often talk about expertise and what we don't know and what we do know, but we're really focused on the notion that the expertise that patients bring us is an absolutely vital part of how we can care for people. And I have learned from you three today that there is a huge body of expertise that we need to listen to carefully that resides within you and others. We're currently in a time when clinicians, regulators might advise caution, and I know that in the medical community. The science and teaching might not be aligned in a common direction. Clinicians might feel a tug between their duties, such as not causing harm and providing benefit, when they're uncertain about their actions resulting in either harm or benefit. Taking into account that uncertainty, what advice would you have for clinicians about how they can best interact with you? And maybe I'll start with you, Sarah.
Well, when Maya you're talking about basically benefit versus risk. And when Maya was first diagnosed with Ohtahara, she was put on a myriad of drugs that they didn't know would work or not. And some, as you're aware, can cause seizures. So one of the drugs that she was on to stop her seizures, topiramate, Topamax, actually increased her seizures fourfold. So we really don't know. You can have an idea, you can theorize as to how someone will react to a certain medication, but we don't know. And cannabis is really no different. I really feel that just sitting and listening and having an open mind and listening to all of the things that I have to say, like, I do have a very understanding neurologist now. He's fantastic. And he wants to see all of the progress that my daughter's made on cannabis. I feel like that is something that physicians can be doing. Okay, well, let's see what good is coming into your life by introducing cannabis as a medicine, instead of just fluffing it off because they don't understand it or they don't understand the system, they don't really want to talk about it, there are liability issues, they don't want the College of Physicians and Surgeons coming down on them, so they just kind of back off. And instead of doing that, listen. Just listen. That's all I've ever wanted and asked out of a physician. I might not agree with their thinking or their course of treatment, and they might not agree with mine, but giving me the respect that I give them by just hearing me out, I think can bridge a lot of gaps between patient and physician relations.
Thank you very much. Holly.
For me, I think it's a partnership that you have with your physician. It's a collaboration of health. It's patient and family-centered care. And it's giving control to the patient. Like the difference with medication and medical marijuana is that the patient has control of that medical marijuana, of how much they take, of how much they need, or when they take it. Whereas when you are prescribed 6 to 12 pills a day and you have to remember to take them all, and it takes over your life, really. And with marijuana, it's just not like that. It's a partnership and sharing that control together. So,
Ryan.
I think I just want to say prescription medications, there's thousands out there and they do help, but they also cause horrible side effects and things. For example, prednisone gave me severe osteoporosis at 37. Medications have caused 3 or 4 of my medical conditions. Cannabis, I can go 1 day a week, I don't care if I take it, if I need it, I need it. I miss 1 or 2 doses of an opiate and I'm in serious trouble. And have to live like that to me is horrible. So if there's a better alternative that has a safer for your body in the treatment, I think that they should have a serious look at that. And it takes the discussion between the doctor and you to realize that, yes, it works for you and it is something I agree with. And my doctor, I'll tell you right now, I'm her only medical marijuana patient in the last 15 years, but she understood how much it helped me, and I'm trying to teach her or let her know how much better it is for other people as well.
Thank you. There's a question from the audience. Have any of you experienced challenges regarding tolerance increase And if so, how has it been addressed? Maybe we'll start with you, Holly.
Yes, I have. That's a really good question. I have increased my tolerance with the medical marijuana, and that's the same thing really with anything you take. You increase tolerance to it. I just have increased my usage when I need to, and that's pretty much it. Like you follow a physician at Natural Health Services, and you go in and you have appointments just as you would with your family doctor, and they will increase it for you or tell you to take an oil versus the herb or something like that. Like there's always something that you can do, an edible even. So it's, yeah, you just work with your tolerance, and that's pretty much what I've done.
Thanks. Ryan?
Yes, you can experience tolerance, and you may have to take more over a long period of time. With the medical marijuana industry, they're producing things that are way beyond anything people had in the past, so you have to sort of learn what your level would be. But again, I'm just going to compare it to opiates. Marijuana, you can smoke when you need it and take time off. Opiates, you're guaranteed in time you will have to increase your dose, and you'll have to do it again, and you'll have to do it again, and eventually it's the end of you. So.
Thanks. Sarah?
Well, for my daughter specifically, I haven't really noticed too much of getting acclimated to a certain dose of THC versus CBD, but there will be times where I switch up the meds depending on if I'm looking for a different terpene profile, or, you know, I kind of get more into that than just THC, CBD. We look at the CBN content, the CBG, and all of that, and I'll just kind of switch things around. And once I switch things around, if I notice that she's kind of off, because usually when she goes into status seizures, it's about 2 days before she's a little bit off, and I can tell. So I'll just switch things up a bit, and she's right back on track. As far as myself, you know, as a patient, I'll just take a tolerance break. If I find that, because I'm paying for it myself, and I have 2 boys in hockey, so when I heard you say hockey coach, I'm like, go Wings, just kidding, they're not in the playoffs this year. But so for myself, I just take a tolerance break. So I'll just take a week or 2 off, and then you just kind of start over where you started from, I guess. It's not, you don't go into withdrawals, you just don't have cannabis. It's pretty, it's not difficult. Whereas before, when I was on a myriad of medications to deal with the PTSD and anxiety, if I didn't take one of those pills, I was getting brain zaps, dizzy, I wouldn't have been able to drive, throwing up, joint swelling, just awful if I missed a dose. But with cannabis, I'm like, oh, I think my tolerance is getting a little bit too high. I'm gonna back off, stop using it for a couple of weeks so that I don't have to spend more money. For me, it's about money.
Thank you. I'll just do a quick time check. Aleem, do we have about 6 or 7 minutes left?
Yeah, why don't you take 5 more?
Okay, thank you. Is there a question from the audience? As medical users, what side effects are most concerning or bothersome to you? And we'll start with you, Ryan.
I have to admit I don't have any side effects from smoking marijuana. But like I said previously, from other medications, it caused me numerous other diseases, and I had many. I mean, I have severe Crohn's. I had to have surgery at 37. They tried so many medications on me, and ended up causing pituitary failure. You know, it's not a dangerous in comparison.
Thanks. Sarah?
Well, I can't really see any negative side effects. I mean, well, the munchies, I try and stay away from that. So I look for strains high in humulene, which actually is an appetite suppressant. That's it. I'm just nicer. I'm a better person. I've said that to people. I've said that to so many moms that come in to our store and you know, are very Airdrie's, you know, rural Alberta, and that's, you know, where I live, and there's a huge stigma out there. I mean, everybody has their garage doors open come May, and they're all boozing until October. That's completely normal, but if you bring up cannabis, you're like, that's the devil's lettuce. But I don't really see any negative effects. Like, I mean, you're a hockey coach, so you understand how hockey parents can be. Well, I'm not like that because I will use cannabis before I go into
That is the real test. Are you a nice hockey mom or not
I
a
am,
nice hockey mom?
I'm a hockey mom, and like I have 2 in hockey, and one's a goalie, so I'm a little off. To produce a goalie, I think.
I'm
you
just
have
going to
be
sit
little
over
off.
here a bit. And so, yeah.
Probably should, because actually people do that at hockey games because when my son's in net, I play goal for him. So I've hit some of the people on my team by accident,
Holly.
on purpose.
I think for me, I agree with you 100%. I'm a better mom, actually. I'm not angry. I don't snap. Like, you know, it's as a working mom and someone who's in pain constantly, it's really easy to take it out on the ones you love, right? And so it makes me a better person. It gives me dry mouth, which kind of sucks. That's about it. I got some water though.
It's healthy. Water is very healthy.
Water is good for you.
So last question. This will be maybe an answer that will help the O'Brien Institute as well as the researchers in the room. What's the first clinical trial you would do if you were asked to advocate for a single clinical trial? I'll start with you, Holly.
I think for chronic pain, absolutely. I would be very interested in that. And in mental health, PTSD, for sure. I think it would be amazing. I would jump in on that in a second.
And Sarah.
Well, obviously, I would advocate for these 2 different studies. Obviously, one would be the pediatric epilepsy out of the sick kids at Toronto. And also, we're conducting an opiate study, so an opiate reduction, harm reduction study through NAC, National Access Cannabis, and we're paired with Phytosciences down in the States to actually help patients get off of opiates and using cannabis as a medium to do so. So that's another, there'd be 2. Because there are 2, my sister has been on opiates for years because of chronic pain, and obviously my daughter, so those 2 causes are very near and dear to my heart. I guess I kind of put myself in the back burner, so we'll go, you're advocating for the mental health, so I'm on board with that. And then I'll advocate for the pediatric and the opiates.
Great. Thanks you. And Ryan.
With the upcoming potential legalization, I think the biggest issue that's going to face everybody is the driving issue, because you're going to have patients that don't get as high as others, are good drivers. You have, I believe, drivers that can still drive perfectly if they're high compared to alcohol. And so I think you need to have somebody study that, get them behind the wheel, see what happens, test it against alcohol, compare it. Or how are you going to set a limit of what someone gets? I think that is going to be just a nightmare issue for the public health and the legislators to figure out.
So in a couple of seconds, 3 or 4 very good ideas of potential research that can be done. I guess we'll return to the opening of this session. You know, when we talked a little bit about the idea that we absolutely have to have better knowledge and awareness. We need to get the expertise from patients and users, the public, from researchers, from academics, from policymakers, and all others. And we have a responsibility to do that. So we have a job ahead of us to advocate for this kind of thing, partly to reduce the stigma that we will get reduction around when we have better knowledge that will guide us as clinicians, policymakers, researchers, and patients better. So I'd like you to join me in thanking this fabulous panel for their openness and their skill.